My specialty in training is obstetrics and gynecology. It has to do with the care of females up through their reproductive age to including delivery and carrying further, hormone replacement, surgery procedures that are sometimes required following deliveries, and then following them through menopause as well. As I've gotten older, I'm tending to focus more now on gynecology to include yearly screenings, mammograms, pap smears, blood work, and hormone replacement therapy, which most females will require somewhere in their 40s. Also around that time, issues with pelvic organ prolapse and stress incontinence that come standard equipment with childbirth a large part of the time. I've gotten to where I focus most of my time on surgeries and corrections than OB at this point in my career. I'm very interested, and always have been, in diseases that affect females that they typically would not talk about. And more specifically, I'm talking about the pelvic organ prolapses and the issues with bladder incontinence, bowel incontinence, painful intercourse, issues that females typically will not bring to your attention. My patients know they're going to get asked about it when they hit the door, so I take that out of their hands. I'm going to make the assumption that these things are going on to a certain degree. The question is, what degree? But I think opening that door gives them the opportunity to say it's okay to talk about it. And I find in my field that it's not really brought up that much, and so women kind of suffer in silence, as the saying goes. Frequently in my world, what people come in for has nothing to do with really what's going on in their world. It's what they come in the door with. The question is, are you going to give them the opportunity to tell you? Are you going to give them permission to tell you? Are you going to ask the questions open-ended and almost expectedly that makes them comfortable telling you? Because if I do not know what I'm fixing, I can't fix it. If they're looking for someone to listen to them, then that is my practice style. I'm not trying to see how many people I can see in a given day. I'm interested in fixing the person in front of me and not looking 2 and 3 patients down the road. And I think that's the only way you can fix the more complex issues, is to understand it. And to understand it takes time, and there's simply no substitute for that. The coolest thing is being able to fix a problem. And those problems, or I should say correcting those problems, is more gratifying when the patient has given up hope. They maybe have been to several places. Maybe they've never really been honest about what was going on in the first place. But there's something very gratifying to finally fix a problem. You see the smile on their face. You see the weight lifted. Finally, someone listened to them and fixed what was truly their problem. And that makes me very happy. And that's going to take some time equity sometimes. But if you're willing to stick in there, those are the most gratifying patients.